Hello everyone, I'm Dr. Yoga Lakshmi, consultant obstetrician, gynecologist, laparoscopist, IVF specialist at United Hospital, Bangalore. Today, I'll be dealing with an important topic of discussion, that is menorrhagia. Menorrhagia in medical term is heavy menstrual bleeding. In the layman term, the bleeding which is prolonged, which is longer than 7 days. Amount about 80 ml. There are many causes of menorrhagia. The most important cause will be the presence of hormonal imbalance. That is, irregular periods. The patient can present with the different types. So once in 1.5 months or 2 months or 3 months she can have periods. Otherwise, one day with the hormonal tablet she gets her bleeding. This is termed as an anovulation. So that also includes the other definition that in a normal female, every month there will be a release of egg. So during the fertility. But in the cases of anovulation, the patient doesn't have these release of eggs and they do not get the bleeding unless it's treated. So this is called as an anovulation. The other causes will be fibroid, the presence of mass within the uterus, so it can be at a different location. The other causes are polyps and the systemic disorders. Depending upon these types, we do plan and treat the patient. So what the concern, the patient actually comes to the hospital and she wants to treatment for it, we do plan accordingly. If they are very bothered about the periods without any fertility issues, then we will go about giving the simplest thing, that is oral contraceptive pills. So it can be the combination pills containing about the estrogen and the progesterone, which is the most commonly used. Otherwise, it will be the progesterone pills. We do have other types of treatments where we will treat the endometrial layer, that is the lining, with the different types of the invasive procedure. That's called as an ablation therapies. Depending upon the age, depending upon the type, we decide which type to be treatment. The last resort, if the patient is actually not responsive to anything, any of those treatment, whatever I have described, so we do hysterectomy. And then we have the other types also, such as a Menorrhagia insertion. Once the patient has put on the hormonal pills, especially in the case where the patient has completed her family, we do have this Menorrhagia treatment. Menorrhagia is nothing but the copper tea, so which will be containing the hormone. So these Menorrhagia will be inserted once we know what will be the underlying pathology. Before we proceed to these hormonal pills, we want to know the endometrial lining tissue, whether it is normal or abnormal. So we do the DNC in the cases of perimenopausal and the postmenopausal, and we detect whether it is normal or abnormal when we do proceed, depending upon the stage. If you want to know about these types and what you are actually undergoing, please do consult me at the United Hospital, Gynaecology for the further details. Thank you.